Hello and welcome. Today, we're diving deep into a lesser-known, yet significant, condition affecting the vascular system, May-Thurner syndrome. Understanding this syndrome is crucial for early diagnosis and effective management, so let's get started. May-Thurner syndrome, at its core, stems from chronic compression, specifically the left common iliac vein, which carries blood from your left leg and pelvis back to the heart, gets squeezed between the right common iliac artery and the lumbar spine. Think of it like a garden hose being pinched. It restricts flow and can cause problems downstream. The persistent compression causes several changes. Over time, the constant pressure damages the vein wall. This damage leads to the formation of intraluminal spurs or webs within the vein, further narrowing the passageway. This restricted blood flow results in increased pressure in the left leg veins, leading to venous stasis and potentially blood clot formation, also known as deep vein thrombosis or DVT. While the exact prevalence of May-Thurner syndrome is difficult to determine due to many cases going undiagnosed, it's estimated to affect between 2 and 5% of the population. It's often discovered in women in their 20s to 40s, but it can occur in men and at other ages as well. Certain anatomical variations and predisposing factors, such as scoliosis or dehydration, may increase the risk. The symptoms of May-Thurner syndrome can vary significantly. Some individuals may experience no symptoms at all, while others may suffer from chronic left leg pain and swelling. Other common signs include varicose veins, skin discoloration, leg ulcers, and the potentially life-threatening complication of deep vein thrombosis. The presence of DVT significantly worsens the symptoms and necessitates immediate medical attention. Diagnosing May-Thurner syndrome typically involves a combination of physical examination and imaging studies. Doppler ultrasound can assess blood flow in the leg veins. However, the gold standard for diagnosis is venography, an X-ray of the veins after injecting contrast dye, which allows visualization of the compression and any associated blood clots or venous abnormalities. Computed tomography as CT, or magnetic resonance, MR venography are also frequently used to assess the iliac veins and the surrounding structures. While May-Thurner syndrome doesn't have distinct types, in the way some other diseases do, the severity of the condition and the presence of complications like DVT can influence the treatment approach. Treatment for May-Thurner syndrome aims to relieve the compression and prevent further complications. Anticoagulation, or blood thinners, are essential to treat and prevent DVT. Thrombolysis, a procedure to dissolve existing blood clots, may also be necessary in some cases. The cornerstone of long-term management involves relieving the venous compression. This is typically achieved through angioplasty, where a balloon is used to widen the narrowed vein, followed by stent placement to keep the vein open. In rare cases, surgical bypass may be considered. Unfortunately, there are no definitive preventative measures for May-Thurner syndrome as it's often related to anatomical variations. However, maintaining a healthy lifestyle, including regular exercise, staying hydrated, and avoiding prolonged periods of sitting or standing, can promote healthy circulation and may reduce the risk of developing complications such as DVT. The prognosis for May-Thurner syndrome depends on the severity of the condition and the presence of complications. Early diagnosis and prompt treatment significantly improve outcomes. With appropriate management, including anticoagulation, thrombolysis if necessary, and stent placement, individuals can often experience significant symptom relief and a reduced risk of recurrent DVT. Research is ongoing to better understand the underlying mechanisms of the syndrome and to develop more effective and less invasive treatment options. This includes studies exploring different stent designs and techniques to optimize long-term patency and minimize complications.